So the government has come out with these RAC audits, which are really where they have contractors that on behalf of the federal government look at the regulations. They come out, they go through, and it can cover a myriad of things. Like, for instance, I was at a hospital the other day, and the CFO was telling me they had been audited on their Jerry Psych program, and the RAC auditors came back and said they've been over reimbursed by $3 million. And they were they were astounded. So they went through it, and finally, when it all shook out, pushing back, they owed $1,600. So the problem with these RAC audits, the auditors are paid based on their findings, so they're going to interpret the laws one way, and so there's always a interpretation of those laws, and it's how you interpret them. And so I think one of the things our clients are going to be faced with is on the meaningful use money. So many people have instituted electronic health records, and so they've had to attest that they provided and done certain things to get the meaningful use money. And so part of what they've had to do was perform a risk assessment and a security assessment around those new electronic health systems that produce the electronic health records. And so many clients have just said that they have done those, while in fact they haven't really hired an outside entity to come in and audit those. And that's something that CRI can provide for those hospitals that have checked the box but hadn't really performed that service yet. Because when those RAC auditors come, they're going to be asking for those security assessments of those. And so that's something that CRI can definitely help those hospitals with. The other thing I think that we can help them with is on the, part of, again, how much incentive you get is based on your charity care. And so, again, they've estimated their charity care one way on their cost report. And so you want to make sure that cost report and the data behind that is really accurate. And so that's another way we can help, because again, that's a big part of how much money you're going to be reimbursed for your electronic health record. And so if that is not done correctly, then that'll be an area the auditor is going to attack. So again, that's something that CRI can come in and help the client understand, the proper way to make sure they have the documentation to support their charity care number that they use for their meaningful use money. So those are just some of the things I think that many of our clients are going to face as the regulations continue to increase and they get more audits from the government. So.